In this video, we will be seeing about the median nerve. We will be studying the median nerve under different regions: the axilla, the arm, cubital fossa, forearm, hand, and we will be dealing with some of the applied aspects in the end. First, we will deal the median nerve in the axilla. So, in the axilla, the median nerve is taking its origin from the brachial plexus. Before going further, we need to understand the brachial plexus is a group of nerves which are interconnecting each other in a specific manner so that it can provide the necessary nerve supply to the upper limb. It will be consisting of roots, trunks, divisions, cords, and branches. We will not discuss the intricate details of the brachial plexus in this video. We will be focusing on the median nerve alone. We will be seeing the details of brachial plexus in a separate video. This is a schematic diagram showing the formation of brachial plexus. If we look specifically, we can identify the roots, trunks, division, cords, and the branches of the brachial plexus. We can also identify these are the cervical vertebrae, and this is the area of intervertebral foramen, and through this intervertebral foramen we have the emergence of anterior primary rami of C5, C6, C7, C8 and T1 spinal cord segments. It is necessary to identify the formation of median nerve in this particular diagram. So this is the median nerve. We can clearly see the median nerve is formed by two roots, one from over here, one over here. To identify these two roots, we need to identify the cords first. The cord over here is known as the lateral cord, and the cord over here is the medial cord. These are named according to their relation with the axillary artery that we will see in the next figure. So from the lateral cord and medial cord, some fibers converge and they together form the median nerve. We will see its further relations and closeness to the important structures of the axilla in the next slide. This is a schematic diagram showing the axilla. Here we can identify the relations of the median nerve with the corresponding structures present in the axilla. Before going into that, we need to identify the source of the fibers which are forming the median nerve through lateral root and median root. When you consider the lateral root of median nerve that we have seen in the previous figure, it is formed from the lateral cord and it carries the fibers from C5, C6 and C7 spinal cord segments. The medial root, it carries the fibers from C8 and T1, and the medial root is actually the continuation of the medial cord. We cannot say it is the continuation, actually it is derived from the medial cord. So in the first diagram over here, this is the holistic view of the axilla, and the artery that is present in this region will be the axillary artery, which is continuing as the brachial artery into the arm. The vein over here will be the deep vein of the arm region, which is becoming the axillary vein in the region of axilla. Now the second diagram over here is actually the magnified view of the axilla to see the relations further. We will use a different color to show the structures over here. The area that I have marked as 1 is the axillary artery. This structure, which is marked as 2, will be the median nerve, and we can clearly understand median nerve is formed by the union of lateral root and medial root, and we have to identify a very specific relation over here because it is clearly evident in this diagram. This medial root is actually crossing the axillary artery to join with the lateral root. It is not like the median nerve is formed at the exact center of the axillary artery. You have to understand this very particular relationship of the median nerve with the axillary artery. Median nerve is located on the lateral aspect. You can clearly identify the relation in this region. The median nerve is located over the lateral aspect of axillary artery. So why it is located over the axillary artery, even though it is formed by two roots crossing the two roots in relation with the axillary artery? Because one of the root is crossing the axillary artery to reach towards the lateral side. That is why the end product, that is the median nerve, is located over the lateral aspect of axillary artery. At this point, it is also important to note that before leaving the axilla, some fibers from the seventh cervical segment, that is C7, they will be conveyed by the median nerve and are handed over to the ulnar nerve, which is a branch of medial cord. Next, we will trace the median nerve along the arm. So this is a diagram showing the median nerve in the arm region. As earlier, we can identify the arterial component in this diagram over here. That artery is the brachial artery, which is the continuation of third part of axillary artery. Now, if you consider the median nerve, you can clearly identify the median nerve on the upper part. It is on the lateral side of the artery. But around the region, roughly along the middle of the arm, it crosses the artery to lie on the medial aspect of the artery. In this diagram, if you draw the legends, this will be the lateral and this will be the medial aspect. This is superior or proximal, and this area will be the distal. This direction will be the distal one. So it is very clear that the median nerve lies on the medial aspect of the artery over the distal aspect of arm, because of the crossing of median nerve through the middle of the arm, at the region of the middle of the arm. If you want to be more specific, this crossing is actually occurring opposite the insertion of coracobrachialis muscle. So after the arm, this nerve is going to enter into a region over here, that is the cubital fossa. So this is how in the cubital fossa, when you see the structures, median nerve will be the medianmost content and artery will be over the lateralmost aspect. Not lateralmost, lateral to the median nerve. If you consider the branches of median nerve in the arm region, one branch will be given to a muscle that is known as the pronator teres, and some other vascular branches will be given to the brachial artery. Other than this, there is no significant branch arise from the median nerve in the arm region. Next, we will see the median nerve in the cubital fossa. Before focusing on the median nerve, we will see some important aspect of cubital fossa in this diagram first. The second diagram, we will focus on the second diagram, that is the magnified view of the first diagram. So this is the medial aspect, here will be the lateral aspect. So from medial to lateral, the first structure over here will be the median nerve, and the second structure, the artery, that will be the brachial artery, and third one is the tendon. This tendon will be the biceps tendon, and fourth one will be again a nerve, that is the superficial branch of radial nerve. So these are the arrangement of structures in the cubital fossa, and we can see a sheet-like aponeurosis, sheet-like fibrous tissue over here, which is arising from the distal aspect of this muscle. This muscle is the biceps brachii muscle, and this aponeurosis is actually one of the point of insertion of the biceps brachiae into the ulna, and it is known as bicipital aponeurosis. So where is the cubital fossa then? Cubital fossa is actually a triangular area which is formed roughly, I will use another color, roughly along this much part. The boundary will be formed by the brachioradialis, this muscle, then pronator teres. If you draw specifically, this is actually the medial boundary, not the first drawn line. Medial lateral border of pronator teres over here, then an imaginary line connecting between the two epicondyles of the humerus. So when you consider the cubital fossa, it is a very important region because we usually approach the vein that is lying over this region for the venae puncture. Before proceeding further, we need to identify the muscle that you have labeled as pronator teres is over here, which is actually the superficial head, or otherwise known as humeral head of the pronator teres. If you want to see the course of the median nerve, which is actually hidden by the pronator teres, we need to remove this humeral head. That is the view that we are going to see in the next diagram. Here it is. We have removed the humeral head and we can see the cut end of the humeral head over here. Now we have a deep head of the pronator teres over here that is arising from the ulna. So it is known as the ulnar head of pronator teres. At this diagram, we can clearly identify our structure, that is the median nerve. As you have seen earlier, the median nerve enters into the cubital fossa on the medial aspect of brachial artery, which is located over here. This is the brachial artery. And after passing through the cubital fossa, it leaves the cubital fossa by passing between. If you look carefully, you can easily identify the median nerve in this area. We are focusing on this area. Earlier it was having the superficial head of pronator teres over here. Only after removal of the superficial head we can identify the median nerve with this much clarity. So we can clearly say the median nerve is located between the humeral and ulnar head of the pronator teres. Now in other words, we can also describe this area in another manner. This artery is the brachial artery. We have mentioned that it is dividing into a superficial and lateral radial artery and a deep and medial ulnar artery. Our median nerve, I will just rub it off the lines over here to avoid the clutter. Okay. Our median nerve is separated from the ulnar artery by this muscle, that is the ulnar head of pronator teres. What happens to the median nerve after this? It enters in deep to a fibrous arch over here. As we can clearly see, this arch is actually formed by another muscle, and that muscle is known as FDS, which is one of the important muscle of the forearm, and that is known as flexor digitorum superficialis. So this is how the median nerve is entering properly into the forearm by passing deep to the fibrous flexor arch of the flexor digitorum superficialis muscle. Now we can trace the median nerve in the forearm. Before tracing the median nerve in the forearm, we need to understand certain muscular arrangement in this forearm region. We already know this is the superficial head of pronator teres. Then we have the next muscle, that is flexor carpi radialis. Then the next muscle over here is the palmaris longus. For completion's sake, we can see another muscle which is lying superficially over here is actually the flexor carpi ulnaris. If we remove these muscles, we can see the underlying muscle which is lying in the intermediate plane very clearly, and this muscle is actually the flexor digitorum superficialis, which we have seen in the previous diagram. Now we can trace our median nerve better. In the previous slide we have mentioned the median nerve is actually entering deep to the fibrous arch of the flexor digitorum superficialis. This nerve will be closely attached to the deeper surface of the flexor digitorum superficialis, and that will emerge on the distal part of forearm lateral to the tendons of flexor digitorum superficialis. We can see the tendons of flexor digitorum superficialis. These are the tendons of flexor digitorum superficialis, and the median nerve is emerging lateral to the flexor digitorum superficialis tendons. This is the lateral aspect, this is the medial aspect. We are having a magnified view of the distal part of forearm region here. In this diagram, we can identify the tendon of this tendon is the flexor carpi radialis. This tendon over here is the palmaris longus tendon, and we can understand, we can clearly see the median nerve is emerging over the distal aspect of forearm between these two tendons, that is the flexor carpi radialis and palmaris longus, but that is lying in a deeper plane, not in the same plane as that of these muscles. The median nerve then leaves the forearm into the hand by passing deep to a fibrous structure located over this area. This fibrous structure is known as the flexor retinaculum. So median nerve forms one of the important structures which are passing deep to the flexor retinaculum. Now, to study the further branches and course of the median nerve, we will be removing this muscle also, that is the flexor digitorum superficialis, to identify the deeper layer of muscles located in this forearm region. So when you consider this diagram, this is the medial aspect, this is the lateral aspect. We are having a magnified view over here in the second diagram. This muscle located on the medial aspect, on the deeper plane, will be flexor digitorum profundus. This muscle over here will be the flexor pollicis longus. And the muscle which is quadrilateral in shape, which is located over the distal aspect of forearm, will be known as pronator quadratus. So these are the muscular arrangements of this region. And in this magnified view, we can clearly understand we have cut off the tip of the median nerve over here to identify certain other important aspects. When we consider the branches of median nerve in the forearm, we have mainly 5 different groups of muscles, groups of branches, and I will label them one by one. First one will be the muscular branches. Second group, which is the important one, that is anterior interosseous nerve. Then we have the articular branches. Fourth, cutaneous branches, and finally we have communicating branches. Among these, the most important one will be the anterior interosseous nerve. Other branches are also important, but specifically anterior interosseous nerve deserves more importance. I will just rub this off so that we can follow the course of these branches. I will discuss the anterior interosseous nerve at the end of this particular slide. So the first one will be muscular branches. We have already mentioned the branch to pronator teres. It is usually arises proximal to the elbow joint. Then branches to the palmaris longus, flexor carpi radialis, flexor digitorum superficialis. They usually arise proximal to the pronator teres, and branch for the superficialis tendon of the index finger arises in the middle of the forearm. That is very important. Then we have the articular branches which supply elbow, superior and inferior radio-ulnar joints along with the interosseous membrane and wrist joint. Lastly, we have the cutaneous branch. It is known as the palmar cutaneous branch, and this branch pierces the deep fascia and supplies the skin of the thenar eminence and central region of the palm. Communicating branches, they connect the median and ulnar nerves at multiple sites. These probably explain abnormal distribution of muscular branches in the hand. Now we can focus on our star, that is the anterior interosseous nerve. It arises distal to the pronator teres. This is the ulnar head of the pronator teres. We have the anterior interosseous nerve over this area. We can identify this particular branch. This anterior interosseous nerve emerges or arises distal to the pronator teres. It descends in front of the interosseous membrane. We can see the nerve is descending between flexor digitorum profundus and flexor pollicis longus. It is actually running on the surface of the interosseous membrane located between ulna and radius. The nerve is accompanied by an artery. You can see the arterial component over here, and this artery is also named by the same words, that is the anterior interosseous artery. And this artery arises from the common interosseous artery. Why the anterior interosseous nerve is very important? Because it supplies the major muscles, powerful muscles of the forearm, like flexor pollicis longus, lateral half of flexor digitorum profundus, which are forming the digital tendons for the index and middle fingers, and also provides a branch to supply pronator quadratus from its deep surface. It also supplies articular twigs to inferior radio-ulnar, wrist and carpal joints. Now we have completed the course of median nerve in the forearm. We have already mentioned it enters into the hand by passing deep to the flexor retinaculum. Now we will trace the median nerve in the hand. First, we will try to make an understanding of the important structures of the hand region. This is the flexor retinaculum, and group of muscles located over this area will be the muscles forming thenar eminence. And these muscles are named as abductor and flexor pollicis brevis and opponens pollicis. You can see also some small muscles, worm-like muscles, and these muscles are the lumbricals. Now we will see the important distribution of median nerve in the hand. The first diagram over here is actually the magnified view. So just distal to the, I will use another color, just distal to the distal border of flexor retinaculum, the median nerve divides into a lateral branch and a medial branch. Don't get confused. As soon as these branches are formed, they will get further divided into common digital or proper digital branches. So it will have a medial branch and a lateral branch. Just before giving rise to these branches, the median nerve gives rise to another branch over here. We can identify this branch. This is the recurrent branch. Recurrent branch arises from the median nerve just distal to the flexor retinaculum. And this recurrent branch supplies the muscles of thenar eminence. Now we will focus on each of these medial and lateral branches. First one, the lateral branch. The lateral branch, we will trace them in the second diagram over here. The lateral branch gives rise to, as you can see, 1, 2 and 3 proper digital branches which supply the skin of both sides of the thumb and radial side of the index finger. The branch to the index finger provides nerve supply to this particular muscle, that is the first lumbrical muscle. Simultaneously, the medial branch, it divides into 1 and 2 common digital nerves. So we have two digital nerves, one is located medially, one is located laterally. We will focus on the lateral common digital nerve, that is over here. I think you can see the lateral common digital nerve. This nerve passes distally and divides into two proper digital nerves. And these proper digital nerves supply the adjacent side of index and middle fingers. This lateral common digital nerve gives a branch to the second lumbrical muscle. Now we will focus on the medial common digital nerve, that is over here. This median common digital nerve again divides into two proper digital nerves which are supplying the adjacent sides of middle finger and ring finger. One of the important aspects to note at this area will be this communication. You can see this communicating fiber. This nerve is the ulnar nerve. So this communication is actually happening between the medial common digital nerve of the median nerve and the common palmar digital branch of the ulnar nerve. Sometimes, majority of the times, third lumbrical is supplied by ulnar nerve only, but sometimes the third lumbrical also gets nerve supply from the median nerve. So if you look at the summary of distribution of median nerve in the hand, we can see it supplies 5 muscles. 3 muscles are supplied by the recurrent branch of thenar eminence, that is the abductor, opponens and flexor pollicis brevis. Then 2 lumbrical muscles, first and second lumbrical muscles. If you look at the cutaneous supply, the skin of the lateral 3 half of the digits, including the joints of digits and local blood vessels, are supplied by the median nerve only. So that was regarding the course, the distribution, the branches, the relations of the median nerve. We will see the applied aspects of median nerve in the next video.